Morning team. How do we manage iliotibial band syndrome or ITB syndrome? That band of soft tissue runs from your hip down the side of your leg to your knee. Very, very common in runners. Very common in people who have weak glute muscles that are unable to stabilize their hips and pelvis. Common symptoms, pain or discomfort on the outer side of the leg. Sometimes might be described as a deep aching or burning sensation. Sometimes people think it's sciatica because it sort of gives them that pain down the leg that they associate with sciatica. So they're common symptoms. How do we treat it? Well, first of all, soft tissue therapy to the ITB is amazing. So things like effleurage, which is massaging our way through that band. We could do some cross friction, pretty painful, but it works really well. Trigger point, where we're holding pressure into those tight fibrous bands and breaking them up that way. If you're into some really painful stuff, we can use instrument assisted techniques where we're actually using an instrument and almost like grinding or scraping the skin. That gives you that characteristic sort of big, bruised, red looking muscle. Creates a lot of blood flow, but it is fantastic at reducing adhesions and relaxing those tight fibrous bands. As well as that, we could do some dry needling, stretching of the ITB, which I'll provide a link to another video on how we stretch our ITB. And as well as we've got to do some rest. So whatever the activity is that is affecting or giving you ITB pain, we need to identify that, reduce doing that for a period of time until we can get your symptoms under control, and then we can get you back doing your normal activity. So massage, stretching, relative rest, they're probably the three key ways to manage ITB syndrome.